Thank you so much for having me today. I'm so excited to be able to share this research with you. I've been working on my PhD since 2017, and I feel that I have a lot to offer in this realm because the fields of planning and public health have not necessarily been communicating effectively. So the title of my presentation is Measuring Success in Food System Planning. The focus of my research is definitely on evaluation within this realm. Before I get to food system evaluation, I feel it's important to provide a brief overview of the shared history of planning and public health. I'm going to apologize in advance for any planners with us today, as this section will unlikely be new information for you. However, I feel it's extremely important to raise awareness to enable effective collaborations between public health and planning. Public health and planning have a shared history. Both professions exist to promote the best possible health of the population. Many of the early successful planning and public health interventions included vaccines, implementing building codes to reduce fire hazard and improve air quality, implementing sanitation systems for clean water, and zoning for safety and disease control. So zoning out industries so we can reduce pollution where people are living and working. These early successful interventions had a typical pathway where the problems were identified and solved by individuals with technical expertise. This type of planning is called a normative theory, where there's a problem that's identified and there's a straightforward solution that has been established to work to address the problem. Public health continues to use this strategy. The goal of public health is to complete evaluations and literature reviews to identify interventions that are effective to promote public health. In practice, once we identify an evidence-based strategy, we can then be confident that we can go forth and advocate for this effective intervention to be implemented. In this context, it's to enhance the diet quality of the population or the sustainability of the food supply. However, planning has moved beyond the idea that planning professionals can independently identify problems and implement effective technical solutions. The field of planning has become self-aware that the problems we are now trying to solve are wicked problems with no clear universal solution. Any planning intervention has the potential to create messy and unintended negative side effects. Planners are educated to move beyond normative theories that have a single universal answer and are comfortable with the complexity of the problems they are addressing. There's no singular truth or best practice. Instead of a single effective normative theory, planners seek to know what is most likely to be helpful in this community at this point in time under these specific circumstances with these different groups of people. They generally refer to it as the science of muddling through. There are, of course, always exceptions to every rule. And there is one commonly used best practice in city planning, and that's mixed land uses. And the quote here is, the co-location or immediate proximity of homes, workplaces, and services in buildings, neighborhoods, and districts has become a central principle of good 21st century city form. Indeed, it might well be called the contemporary urban planning mantra. And so what you see here is that mixed land uses are believed to be the most beneficial type of land use. We have small, compact communities that are easier for individuals to move around in. Jobs and food outlets are close to home. Mixed land uses intends to move away from cars as the primary form of transportation. And if there are many people using the space, it creates community safety. They call it eyes on the street. This photo here is an example of the ideal implementation of mixed use with small shops at the bottom of buildings, which are packed tightly together. Above the shops are housing. And the area has few cars and is attractive and safe for people to walk around and enjoy the setting. You can see how you might run into other people. It's very socially collaborative. So while evaluation and literature reviews are helpful to push us in the right direction in public health and planning, it's important to evaluate the outcomes of interventions to ensure that the actual outcomes reflect our intentions. And that way we can minimize any unintended negative outcomes once we become aware of them. So here you can see on the left the ideal mixed land use practice. So we've got our compact communities that we have seen that were established in Europe and North America. They existed before cars, and that's basically what's aspired to. They create vibrant and safe walkable communities. However, in North America, the retail that often gets implemented is that you'll still have these large swaths of residential space, and then you'll see a car-centric strip mall in the middle of a subdivision. So mixing retail land uses with residential land uses is one mechanism the planners use to prevent food deserts. And this is usually defined as having access to a food retailer within 1 kilometer of your home. However, there's no guarantee that a healthy retailer will be established in the retail space like a strip mall. Typically, grocery retailers want to locate on the edges of the community where they can find a large piece of land that they can have a large parking lot and a large building, as these are more economically viable compared to a small retailer within a small strip mall. Some studies have found that retail placed within other land uses attracts retailers that sell highly processed foods, and this is especially true in areas that are close to locations where children live, learn, and play. In some countries, such as the United States and United Kingdom, planners have limited the placement or proximity or density of fast food retailers in settings that are close to where children live, learn, and play. Seeing these examples of other countries implementing planning interventions to restrict retail in certain areas can motivate similar requests here in Canada. However, I feel that public health practitioners, myself included, do not have a foundational understanding of the history of planning in North America. When I began my education in planning, I was not aware that the problems we are trying to solve are very old problems. And I feel like this is the most important thing that I've learned in this degree so far. So as you can see in this quote from 1917, decision makers had recognized the negative influence of some retailers on the well-being of children and used this as a rationale to implement zoning bylaws in the form of separate land uses. So in Canada, they're residential, commercial, and industrial, I believe, are the three categories. So you can see highlighted in yellow here, ordinary businesses street is not a favorable environment in which to rear children. The candy store and other institutions for the creation and satisfaction of appetites and habits is not good for the development of the child. And the year is 1917. When I saw this quote in my textbook, I was really blown away by it because I was not aware that people know about what we're talking about, and it goes really far back. And so the fix for it was to implement separate land uses. So what government started to do is separate out residential land uses from commercial and industrial land uses. And this is how we got into car-centric suburbs. What also happened is the downtown areas in many cities had fallen into disrepair. And so the government basically bulldozed them and then created commercial areas in the downtown core. And this is why a lot of cities in North America, you'll see like big stadiums and a lot of office buildings and not that much residential in the downtown core. So since that time, it began about right after the Second World War, we've realized that creating solely residential settings like suburbs are very damaging from an economic perspective and also from an environmental sustainability perspective, because everybody requires a car and we have to drive a long distance to go get groceries and to go to work and to go to school. And so this is why mixed land use has fallen back into favor as the most optimal type of the way to design a city. Areas with a high concentration of people living with low income were removed. In many cases, they were not provided with housing after their housing was demolished. And then in conjunction with that, especially in the States, racialized populations faced discrimination. So they were not able to obtain bank loans or purchase property in the suburbs. And so that has a generational effect that's still visible today in racialized populations, because if people in our family were able to buy a home in the 50s using a loan, then we could use that money to go to school and so on and so forth. And if you didn't have a home, you have nothing to leverage for loans. And so we still see that generational effect today. So understanding planning roles in Canada, every province has its own planning act that governs the role of the planner. And Canadian planning laws are not the same as the United States or United Kingdom. Therefore, the interventions that we see noted in the literature do not necessarily translate into a Canadian context. So to preserve the ability to have meaningful conversations, it's important to understand the role of the planner in your jurisdiction. For example, in Canada, planning is a coarse tool. Planners are able to designate land uses, but not land users. Asking planners to zone out a fast food restaurant in close proximity to schools is kind of like asking someone to sew on a button with a hammer. Zoning is the wrong tool in this context. So the only action that planners can take is to zone away all retail from a school, which again, does not coincide with the best practice of mixed land use. Similarly, planners cannot avoid placing a school next to an area with a high concentration of food establishments, because in Canada, school location is determined by the school board. And then it becomes difficult to coordinate where retail uses will be placed in relation to schools because there's more than one decision maker involved. Therefore, the act of separating schools away from retail settings requires collaboration between the boards and the planners to co-locate schools with other beneficial school services like recreation centers or public libraries. The role of planning is to protect populations from harm, so there is a case to be made that certain retailers should not be in close proximity to schools. In Ontario, for example, we have a Tobacco, an Alcohol, and a Cannabis Act to control these substances in relations to where children learn. In provinces where planners may restrict users, it is also important to keep in mind that restricting retail uses does not align with best practices for planners. Mixed land use is a best practice. Restricting retail is contrary to economic development goals, which is a primary concern of planners. And although planning can be used to promote and protect health historically, there's not a robust evidence base that restricting food outlets will result in the desired health outcomes. And I feel that this is because it's very difficult to find an area without a lot of food retail in it so that you were able to compare and contrast. So it's very difficult to find your control setting to compare. So without a robust evidence-based, interventions are easily challenged from a legal standpoint, and this puts planners in a difficult position with respect to attempting to restrict a particular retail use. So it's probably very difficult for them to do it. They have to take a lot of convincing, and then there's a lot of risk involved with trying to do that. So if you are provided with an opportunity to consult with your local planning department and have specific requests in mind, it's recommended that you consult with your provincial or territorial planning act to identify what is possible within your respective act. It's also important to note the realities of how municipalities may make decisions. There isn't always the time and the resources available to evaluate or research planning interventions for effectiveness. So in this study by Nikki Forick, they used the policy diffusion theory to identify municipalities that implemented a full or partial drive-through bylaw. And the study found 6 innovators that implemented the policy based on concept only, and then 21 subsequent early adopters. And so on this slide, you can see the different reasons that you might want to implement a drive-through bylaw. Note that health is on the bottom of the list. And so at the time that this article was published, there was no evaluation of any of the impacts of this bylaw policy. Of the 27 municipalities that implemented the intervention, only 9 undertook a learning process to inform the strategy before the bylaw was implemented. 12 municipalities implemented a bylaw as a result of seeing other municipalities doing this similar intervention. So this echo process can occur even if there has been no evaluation to prove effectiveness or to identify unintended consequences. So moving on to defining success, the success of interventions is partially defined by the outcome indicators selected. Ideally, planning interventions will enhance the nutritional quality of accessible food, promote population diet quality, enhance the sustainability of the food system and the built environment, and also promote economic development and encourage physical activity. But due to the realities of wicked problems, it is not always possible to have positive outcomes in all of these areas. At times, interventions will result in positive outcomes in one area and then create unintended negative consequences in another area. So an important rule of thumb when selecting outcome indicators for evaluation is what gets measured gets done. So here's a good example of that. In the early 2000s, the popsicle test was the rule of thumb for building your ideal community. And the idea was that you wanted to have close geographical proximity of retail to children's homes. And their ideal community, an 8-year-old could walk to the local store and buy a popsicle and get home before it melted. And that was how they defined success. And if you were to use this geographical indicator as the only indicator of success, it would be easy to declare the implementation of these retail interventions to be successful. However, if you start to apply other evaluation criteria, such as children's diet quality or the economic success of small neighborhood retailers, then the intervention may become less effective. There's a lot of evidence about the relationship between children and convenience stores on their diet quality, but also from an economic standpoint, in 2016, 25% of the convenience stores in Canada were not profitable. So having too much retail might not achieve the economic development goals that they were set. Here's a similar study. So this one found that the availability of a diverse combination of retail food destinations within walking distance from home may provide opportunities for adolescents to achieve more physical activity. So using a single indicator of physical activity, you might deem the adding highly processed food retailers within a community to be a success because you can get adolescents to walk more. But once you start to apply outcome indicators like diet quality or environmental sustainability, the intervention then becomes less successful, and you can start to see the negative unintended consequences of promoting more retailers that offer highly processed foods in a neighborhood. So once again, ideally you want to apply a number of different outcome indicators so that you can see if you're promoting an intervention that leads to one positive outcome to the detriment of other desirable outcomes. So evaluation can help to identify which interventions are helpful in specific contexts. Decision makers can then use this information to continue to stop or modify interventions. The consequences of poorly informed decision-making can lead to a misallocation or wasting of resources, damage to planners' reputations, and missed opportunities to implement effective interventions. The framework for my research is based on this 1999 article by Pothukuchi and Kaufman. And they focused on the importance of the food system planning in the context of urban planning. While food systems are generally thought of as agricultural or rural, this landmark paper highlighted the importance of urban food systems in particular and encouraged urban planners to incorporate food system considerations into municipal and regional plans. This article provides an overview of the history of food in cities and advocates for planners and municipalities to consider food industry and economic development, including the economic importance of restaurants and food processors, food waste and environmental sustainability, the diet quality of restaurants and ensuring adequacy of diet and limiting overconsumption of highly processed foods, consideration of food insecurity, consideration of food access, especially for populations living with low income, and then transportation of food as well as transportation for citizens to purchase food. My research has been based on the framework of this paper, and I'm hoping to determine what food system planning interventions have been implemented since 1999 and evaluated, how they've been evaluated, have the interventions been effective to achieve their intended outcomes, and have there been any unintended negative outcomes related to the interventions. So I'll start with non-retail planning interventions for healthy and sustainable food systems. So in the literature, there was no evaluation studies found for preventing or addressing food waste. The anticipated benefits are that preventing food waste is associated, so it's associated with water waste, fertilizer use, wasted transportation, greenhouse gases, and then also packaging. So if food is wasted, there's a lot of resources that go along with it that are wasted. We also want to reduce greenhouse gases associated with decomposing materials in traditional landfill sites. So what happens on the waste side is important, as well as what happens on the selling side as well. Secondarily, agricultural boundaries are intended to preserve land suitable for farming. The boundary serves to limit residential sprawl. And then farming is a key source of economic development. So having local farms can help to ensure that municipalities maintain the option to feed themselves, known as community food security. It's difficult to convert a suburb back into farmland. And the COVID-19 pandemic has shed light on how precarious supply chains can be. So communities need to consider the benefit of having a local food distribution network as well as global one. There's been widespread promotion of local food as sustainable due to the short transportation routes. However, sustainable food systems research has evolved to a point to suggest that local foods are not always the most sustainably produced. So there isn't that direct correlation that we used to use to speak about local food. I did find one study that evaluated plans that included an agricultural boundary. And this article found that there was a lot of pressure to develop agricultural lands, even though there was a guide, there's a plan to guide residential and commercial development away from optimal farmland. And the tension here is that the best kind of farmland is also the best kind of land to build houses as well. And we hear a lot about housing right now. It's a really hot topic. So from an economic development standpoint, the land can provide a larger profit when used for commercial or residential uses, and it will provide an immediate return on investment. This study found that economic pressures led to a legal ruling to allow land zoned as agricultural to be converted back into residential and commercial zoning. So unfortunately, in this case, the economic pressures, there was a failure of the plan to sustain that agricultural land. So what the community did is they actually got together and they purchased back a portion of that land for agricultural preservation. So the summary of the paper talks about how the policy is not impermeable, but it did serve to guide development and stabilize land use. Allowing urban agriculture within other land uses to enhance access to healthy food, especially in food deserts. So what was found in this literature base is that gardening may lead to small increases in vegetable and fruit intakes. Participating in gardens is very beneficial to improve preference for, willingness to try, attitudes about, knowledge about, confidence in eating and preparing vegetables and fruit. So there's many excellent outcomes for allowing urban agriculture within cities. Gardens can be used to educate on topics of science, environment, and nutrition. It's helpful for physical activity, social outcomes, mental health, and sharing food with others, that kind of community spirit. One study did find an unexpected negative outcome with mental health, and they were wondering if this was that poor mental health was the precursor to working in the garden rather than the garden led to poor mental health. Public gardens or orchards may be underutilized if the public is unsure of the safety, quality, or even whether they're supposed to be harvesting that produce. So if you do choose to implement an urban orchard or an urban garden where people can take food from it, you might need to include an educational strategy so that people are aware of what it is and what it's meant for. Cost savings of growing food compared to purchasing food in a traditional store have not been quantified. Another study found that laws and policies to promote or allow gardens may not increase prevalence of school gardens. They did find that the existence of school gardens is more dependent on staff and volunteers to start the gardens and maintain them. Gardens are seen as a positive placemaking strategy, especially for vacant land, but there is caution in the literature because if you are implementing a garden in an attractive land that is only temporary, so it might be developed or sold or some other use might be made for that land, it's very difficult for the participants to let go of that garden, become very attached to it. So just a caution about that. The way food security is conceptualized in the planning literature and the public health literature is quite different. Planning literature often refers to access to food retail as the indicator for food security. So if you have a population living with low income, the most important thing for them is to have close proximity to food retail. The definition for food security in public health literature is quite a bit more multifaceted, and it has a significant focus on having an adequate income to purchase healthy and culturally appropriate food. Several studies mention urban agriculture as a way to address food insecurity. And one study did find a positive outcome, and this was a group of migrant farmers. So the family members were experiencing food insecurity. So they did a garden intervention with this group, and they did manage to significantly drop their food insecurity rate. Another study found that the garden was unable to provide an effective way to alleviate food insecurity. So they had a medical clinic, and there was a number of people involved with gardening. And then the idea was to take the produce from the garden and then give it away to the clinic patrons. And they were able to give one piece of produce each patron. So they acknowledged that that wouldn't be a way to alleviate food insecurity. There is in the public health literature a significant caution about promoting garden or urban agriculture as a way to address food insecurity. Urban agriculture has so many other multiple benefits to justify it as an effective food systems tool. However, relying on urban agriculture as a grow your own reinforces a self-help approach, and it absolves governments of the responsibility to address the structural and institutional causes of food insecurity. And so if we're focusing on gardening instead of things like adequate income or affordable housing, it generally doesn't, it's unhelpful from a policy approach. So just something to be mindful of. Alternate retail planning interventions. So these are places where you can buy food that aren't traditional grocery stores. So there has been talk of allowing farmers to sell food on land that's zoned for agricultural uses. Typically that's not allowed. Agriculture is agriculture. And so the benefit here would be that it's a good economic development strategy so that we can ensure farm viability so that farm producers will continue to stay on the land and produce food. I did not find any evaluation studies for this particular approach. And then allowing farmers markets within other land uses to enhance access to healthy food, especially in food deserts. So zoning and licensing requirements can often make it difficult for farmers markets to establish within other land uses. Zoning to allow farmers markets within other land uses may be beneficial to access vegetables and fruit, especially in areas that are zoned to be food deserts. It may also be a way for municipalities to improve access to culturally important foods that may not be available from traditional retailers. Municipalities may consider actively supporting development of farmers markets by reducing fees and providing infrastructure such as space for the market, public washrooms, hand washing facilities, and inspected kitchen spaces to prepare foods. I will argue that there's two types of farmers markets. The first type of market is intended to provide access to vegetables and fruit for individuals living with low income who may be living in areas with poor geographical access to healthier options. The second type of farmers market is a placemaking and economic development approach that includes many vendors and entertainers. The second type of market may not improve the nutritional quality of the food environment, as it often simultaneously increases exposure to highly processed foods. So the first type of farmers market that I referred to, most of the studies were completed in the United States, which tend to have significantly more food deserts compared to Canada. The markets were also combined with the social programs to provide vouchers or benefit cards to use at the market to purchase fresh vegetables or fruit. So these can include the WIC program, the SNAC program, the seniors program. So there was a number of these types of studies. They definitely made up the majority of the literature base. The farmers market program in the United States also has the double benefit of offering produce in areas where people lack access to healthy food. And then secondarily, it's a way for those local food producers to sell their food. So they look at it as a double benefit for their communities. Most of the studies looked at facilitators and barriers to farmers market development or use. There are fewer studies looking at economic development, food purchasing, or diet quality outcomes. So when we look at them, offering coupons to farmers markets is an effective way to increase vegetable and fruit consumption, especially in populations that are living with low income. The literature talks about how frustrating it can be if you're given a $10 voucher to shop at a farmer's market and there's more than one vendor, they don't give change back. And so if you only wanted one thing and it costs $3, then you've lost $7 worth of buying power. Or you have to make up the extra money with your own money, which they may not have. So the people who were using these programs, they really did want $1 coupons for the greatest flexibility. One market in Canada was located at a healthcare facility, and this enhanced the ability of this population to be able to access vegetables and fruit. And they were actually giving vouchers to go use the market at the health clinic. And it was an effective strategy. Adding services such as recipes and education were beneficial. So sometimes there was like a nutrition professional there to guide people and show them different ways that they can use the produce. And that happened to be an effective enhancement to the market. Most people say that the market was a positive social experience. However, there is talk in the literature about how farmers markets generally draw white, middle-aged, middle-income consumers. And so if your intention is to have a market that's there for people living with low income, they might feel unwelcome in that space because the demographic that's there is unlike them and they don't feel like they belong in that space. So just be something to be mindful of. People who were shopping at farmers markets who came from higher income backgrounds were motivated to support the local economy and the farmers. So there's a lot of social benefits there. Reasons why people did not want to shop at the market were concerns over freshness, cost, variety, and quality, and convenience. And a lot of times the convenience aspect was hours of operation and also transportation options to get there. So there's one market in Flint, Michigan that actually started running additional bus routes to their markets so that on market days so that people could access that. So something to keep in mind is location and hours are extremely important to the success of the market. And the second type of market, which is your more general market, the literature found that they are primary nodes for farmers to sell goods, and that the bigger the market, the farther away people will come to sell their food. So when you're looking at local food, just something to keep in mind. Markets can act as a community gathering place rather than a business. And in one study, a great deal of the people who answered the survey said they had no intention of spending money at the market. They were just there for the social benefits. The location of the market will determine on how successful it will be. and they don't always benefit the surrounding businesses. And in some cases, the businesses resented them being there. They felt that they were competing against the market, so they felt like it was unfair. They can be successful in increasing access and lowering cost of food in a food desert. And the most popular items are the highly processed foods, so the baked goods. So if you're implementing a market as a healthy food strategy and you're introducing a lot of other vendors, it might not be as effective for diet outcomes. Permitting mobile vegetable and fruit sellers within other land uses. Again, if you have very stringent zoning, municipalities might need to allow these types of markets within different land uses. It can be a successful way to increase access to vegetables and fruit in areas that have limited access. They may face fewer limitations than attempting to set up a physical space like a farmer's market. There's a lot of infrastructure that goes along with setting up a farmer's market. So if you have like a bus or a van or another type of cart that offers vegetables and fruit, this might be a way to offer those, especially in places that don't have good retail access. So there was a few studies on this particular topic. It's difficult to assess the economic viability of this approach because there's a lack of economic outcome indicators. So we don't really know if on their own mobile vegetable and fruit vendors are economic sustainable. Some of the literature on food retail questions whether food deserts actually emerged because the population could not afford to spend money on the food rather than having an original lack of geographic access. So in some of the literature, it talks about how there used to be a grocery store there, and then the population just couldn't sustain it, so it closed up, and then it might have become a different type of space. Like it might have converted into retail. So attempting to add retailers back into a food desert may lead to a failure in business if the population doesn't have enough money to sustain it. So it might not just be solely geographical thing to be considered. The mobile vegetable and fruit sellers did find a small increase in vegetable and fruit consumption. And then in the States, they have this type of green market or green mobile vendor, and they found that they're not always located where they needed to be. Often these mobile vendors would set up in areas that had a lot of access to healthy food retail, and they weren't setting up in food deserts. So like I was saying before, it might just be the population doesn't have the money to sustain them, so that they start showing up in other areas where they're not generally needed. When there are economic outcome indicators, they generally reflect individual rather than a business viability standpoint. So how much was spent per individual, or what percentage of the gift cards were redeemed by the people who were given gift cards for this purpose. Most of them measured things like satisfaction, barriers to use, whether or not they intended to shop there again or where they usually shop. And the results have generally been positive. People have a positive attitude towards these mobile vendors. Municipal policies on mobile food vendors from a food truck perspective. So one study by Wallace assessed the types of policies municipalities implemented to create healthier food environments with respect to food trucks. So all 6 municipalities in the studies required mobile vendors to operate out of an inspected commissary for food safety reasons. All municipalities required a licensing fee to operate, but one municipality offered a discount for the mobile operators that offered to sell vegetables and fruit. 3 municipalities required the mobile vendors to offer at least one healthy choice, and this is how they increased access to healthy food via these vendors. And then we're on to traditional retail planning interventions. So adding or modifying existing traditional retail to ensure that people have access to healthy food within a walkable distance. So I included these because planners often incorporate retail within residential areas in the hopes that they will offer healthy food. So if traditional convenience stores are not offering healthy food, these healthy corner store interventions can be one way to try to, an add-on to try to make that happen. Mostly in the States, this has been studied, and it's in the context of being approved as a SNAP retailer. So you can basically, you're able to take the cards for SNAP if you get approved as the retailer, and that's the motivation. Larger corporate stores have an advantage over small independent stores through economies of scale. So the way that distributors work is there has to be a certain demand before they will have it in their warehouse. And if each small retailer is asking for a different thing, it can be very difficult for them to access those healthier foods. So in a way, the wholesaler is a very, very important part of whether or not small retailers are going to be able to offer healthy choices. The studies definitely found that these programs increased access to healthier food. Some of them did show that there was more sales of healthier food, but a lot of them showed no change in healthier food sales. So sometimes healthy corner store interventions can result in a net loss for retailers. And so you have to be very careful about going about these, because it actually can result in a loss for the retailer. One study found improvement in diet quality, and the same study found improvement in health outcomes. So it's a little hit or miss about whether or not they're effective. And again, those in-store interventions of food placement, promotion, education, they all enhance the effectiveness of offering healthy foods in these settings. In the States, again, there was funding from the federal government to try to get healthy retailers to show up in areas that were considered food deserts. They only, of the people who took the money for these healthy corner stores, only 50% of them showed up in the food desert. So you can see that it's not always an effective use of money, that retailers will show up in an area where there's already lots of access to healthy food. Like I was saying before, wholesalers were a significant part of the interventions as they determined what's available to the stores. And then challenges for a healthy corner store are food spoilage and waste. So again, if the consumers aren't actually buying the healthier choices that are available to them, it is a net loss for the retailer. There's a huge financial burden for them. And like I mentioned before, there's a number of corner stores that are already not profitable. So it is a high risk thing for them. There's often a low customer demand and a lack of infrastructure. So they don't have fridges and freezers and that kind of thing for perishable goods. So they require a lot of support and financial support to get these kinds of interventions to be effective. New retail interventions. So this is going into a food desert and opening a new grocery store. So opening a new retail location might provide local jobs in these areas. One study found that the new retail location was accessed by the locals. The new store are most convenient to those who do not have access to a car. So you're talking about 5 to 7% of the population will use the grocery store that's closest to them. Many studies found that people do not necessarily shop at the closest store. And if you think about the way that you live your life, you might go to work and you might shop at the store that's closest to work and then take your groceries home on the bus rather than going home and then going to the grocery store that's closest to your home. Reasons that people shopped at different stores rather than close geographic proximity are the price, the safety. So if you're in an area where there's a lot of people hanging around in the parking lot, that might deter you from shopping at your local store. The quality of the food, the cleanliness, again, welcoming. This came up a lot in the literature about people feeling like they're not welcome in the store. There's not a lot of people like them in there. And so they found a different store where they felt more welcome. Some of them actually were mentioning poor treatment as well. And so this is something to keep in mind when we're implementing retail interventions. And then also being well stocked. The mode of transportation determines how much people will buy. So certainly if you're shopping on foot, you might buy a lot less than if you were managing to take a bus or get a taxi or borrow a car from someone else or have your own car. The literature was very clear that what most people do, especially in the context of COVID-19, is they will get a vehicle, they'll go to the store, they will buy their groceries for a long period of time. And this kind of doesn't coincide with how retail is conceptualized in the planning literature, where you want people to have a retailer in their neighborhood and they might go several times a week and run into other people and talk and converse and make it a more social experience. And so again, we need to check our assumptions about how different interventions will work. Stores may not be able to stay open. There's a lot of low profit margins. As I was mentioning before, some stores were there and they disappeared because of market oversaturation, or the local population couldn't sustain them. Neighborhood availability of healthy foods may not change. So what one study found was opening a retailer, there was a number of small local convenience stores that were offering healthy foods. They stopped offering those healthy foods, and then the healthy foods only showed up at the grocery store. And then many found that there was no change in diet or health outcomes. The last intervention that I want to talk about is zoning to limit exposure to highly processed foods. So zoning restrictions that favor full service restaurants and fast casual restaurants did lead to better quality and more diverse restaurants in one study. Zoning that restricts a new standalone fast food restaurant does not limit opening of a new fast food retailers. This study, they were still open in malls, and so there was no net difference in how many retailers they had. Healthy food policies within schools are more effective if there's a complementary restrictive zoning policy. So something like a national food policy might actually be more effective to affect retail around schools than trying to zone out retail around schools. Planners cannot control the type of food served within stores, even if certain food outlets are limited. So if you think about I can think of a local grocery store that's right next to a high school, and the children are going across and they're getting their fried chicken and their French fries from that grocery store, even though there's not a fast food retailer nearby. This study by Sean Lucan showed that virtually all nearby buildings can sell highly processed food. So it doesn't matter if it's a government building or a hospital or whatever is next by, whatever the sign is outside, it doesn't matter. It will probably eventually become a candy store if it's near a school. And then expectations need to be tempered for effectiveness of zoning policies in established areas. They're likely going to be only effective for new developments. And lastly, food delivery offsets the benefit of geographical interventions. A lot of the planning literature is conceptualized in the best practices in the 60s, before the internet, before mobile apps and this sort of thing. And so we really need to temper our expectations now that you can take a device out of your pocket and have highly processed food show up wherever you are. We really need to rethink about how effective these geographically based interventions will be. And lastly, possible retail interventions in Canada. So just keep in mind that Canada has a lot more retail per person compared to Europe, and that mixed land use is often not successful for retail. It may sit vacant and it may get reconverted back into residential. So if you're talking to a planner and you're concerned about retail space showing up next to something like a school, there is a fair case for asking, do we need this new retail, or does this community have enough retail? Could this be used for something else? And so one thing I want to propose is, especially as some school curriculum is turning back towards food skills, and a lot of schools do not have the infrastructure to teach food skills, we might want to think about that street level business being a small food processing place where small food processors can rent it, schools can use it for food skills training, and then communities can rent it, because often we're having to hand out highly processed prepackaged food because we need to have an inspected kitchen to be able to give food to others at any community event. So I'll leave you with this. We need to evaluate to test our assumptions about the effectiveness of food systems and other planning interventions. I want to recommend that all outcomes be evaluated to detect unintended negative consequences. And then we need to be mindful and ask ourselves, are we trying to fix a social problem, such as lack of income, with a geographical intervention, such as close food proximity? Thank you again for having me.